OSCE key points are the most important in OSCE. You need to keep these key points throughout your OSCE, regardless of assessment station, implementation station, or any of the skill station, other than any writing stations. Is that clear? So we can go through with what are the key points are. So first one is check for safety. So what are you checking in safety? Safety of yourself and for the patient. Then the gel hands, either the hand gel or the hand wash. So all the procedure starting with the hand gel. Then you introduce yourself, check the identity of the patient, check reason for admission, check the allergy, any pain, explain the procedure, providing calling bell, wash hands, wear apron and glove if applicable. Some of the stations you don't need the apron and glove, so in that case you don't need to wear apron and glove. Then you're going to arrange the articles. Then you do the procedure. So procedure will be different for each stations. We will go through each one separately. Hand gel in between the procedure, that is really important. Then documentation, escalation, ADL discussion, that is activity daily living. So that is only applicable in assessment stations. If there is, if you are doing other than the assessment station, straight away after the escalation, you go into the conclusion. So conclusion including, you need to check with the patient, are they comfortable? Is there any concern of the patient? You need to clarify any concerns to the patients. Then providing the calling bell, dismantle the articles and wash hands. So these are the main key points you need to focus throughout your OSCE stations. Now we can go through each key points one by one. So first one is check for safety. So as we discussed, we need to check the safety of yourself and for the patient. Before entering to any of the patient's room, first you need to check the safety of yourself and the patient. While you are entering, you need to show that you are checking the scene safety. Once you checked, you need to say that scene is safe to enter, I am entering to the room. While you are explaining that, you need to show that as well. So like this, so I am checking the scene safety, scene is safe to enter, I am entering to the room. Is that clear? While you are entering the room, if there is a chair like this on your way, what you should do? Will you be able to enter the room? No. So what you should do? So before that, so I'm checking the scene safety. So this chair is in my way. So I'm just moving the chair. It will protect me not to trip over or anything. So I'm just moving the chair. So now once I move the chair, then only it is safe to enter the room. Is that clear? Okay. And the same time, there's any kind of the sign of wet floor and also any kind of wires on your way, anything like that, you need to clear off that first before entering through the room. So while you are checking, if you see any of these kind of hazards, you should say that I'm moving this one. Now it's safe for me to enter. I am entering to the room. Is that clear? So next one is hand gel. So as soon as you done the safety check and you enter the room, you're supposed to do the hand gel. We will do the hand gel procedure completely separately because that's the main procedure for the OSCE. So we will go through that one completely separately. So next, the second one is hand gel. Then you are introducing to the patient. So what all you need to include that in introduction about you. Hi, I am Bindu Matthew, the nurse looking after you today. I'm here to do the observation. So whichever the procedure you are going to do accordingly, okay? So you need to say your full name, who you are, why you are here. These three things included in the introduction yourself. Once you done the introduction yourself, then you need to do the ID check. For ID check, what all you need to do, you will have any kind of paperwork with you for the ID check. Regardless of any procedure you are doing, you will have one kind of paperwork that including the patient's ID. So once you're doing the ID check, you need to verify with the ID of the patient on your paperwork and with the patient ID. So if it is a hospital setting, patient will have a ID band. That will be white ID band. Okay. So you need to check against that ID band and against your paperwork. We'll go through with the community setting separately. So you can just see that how I'm doing the ID check. Hi, can you tell me your full name, please? All right. Is that okay? Can I check your ID as well? All right. Okay. Yeah. Can you tell me your full name? Joe Smith. Okay. Joe Smith. Can you tell me your date of birth, please? 23/7/1972. 23/7/1972. Your NHS number is 258610. 258610. Yes, Joe, I can see that you are my right patient. So I have verified your identity. So you need to ask the patient their full name. Then you need to verify that with your document and with the ID band. Again, you need to ask the patient your date of birth. The same time, you need to check with your document and with the ID band. NHS number patient wouldn't be knowing. So you need to check that in your document. Verify that with the ID band. Then you need to say that you are my right patient. Is that clear? Once you've done the ID check, always make sure you need to check with the patient what is their preferred name. So whichever the way you can ask that one, okay? So either, is that okay? Can I call you Joe? That one. Or you can ask that patient, how can I call you? Or what you prefer to call you? So whichever the way, you need to set that, how can I call you? Okay. So the preferred name, then you need to check that reason for admission. So when you are checking the reason for admission, you will be able to know that is the patient is aware of the surrounding. So mainly we are checking with that one, the patient is alert and oriented. So, okay, Joe, do you know what happened to you? So the patient will be saying that whatever that happened if the patient is fully oriented and those things. Otherwise, you will be knowing that the patient wouldn't be knowing where they are, those things. Accordingly, we need to assurance as well. Okay. So the second one, after the ID check, we need to check the reason for admission. Then we need to go with the allergy check. So allergy check and the pain check, there is no hard and fast rule that you're supposed to do it then and there. But I always recommend that you just go through the same way. Otherwise, you will forget in that one. Yeah. So while you are done the ID check, as soon as you completed the ID check, reason for admission, check the allergy and the pain as well. You can do the pain check first and the allergy check, or allergy and pain after that. Whichever the way, there won't be any problem. Okay. Okay. So is that okay? Can I check, have you got any pain? Okay. So where is the pain? Oh, you got the headache. Yeah. Okay. If I say that 0 is the no pain and the 10 is the worst pain, what you will score? All right. I'm really sorry to hear that you are in moderate pain. So you got 5. So you got a moderate pain. Do you remember, have you had any pain relief? Okay, no worries. I will check on your medication chart, and if I can give some pain relief for you, I will bring that for you. Is that okay? So first you need to check, have you got any pain? Then localize the pain. If it is a chest pain or something, we need to check that, is that radiating to anywhere? Then you need to check the pain score in a pain scale. So 0 is the no pain and 10 is the worst pain. So you need to check that with the patient. 0 is the no pain and 10 is the worst pain, how much you will score. Then if the patient is saying that 0 to 3, then it's a minimal pain. 3 to 6, it's a moderate pain. 6 to 10 will be a severe pain. So accordingly, we need to assurance that, we need to check that, have you had any pain relief before that? if the patient doesn't know, or even the patient says that in recently, then you need to say that, yeah, I can check that, have you got any pain relief or the another pain relief prescribed, or you can say that I will ask the prescriber to prescribe some more stronger pain relief for you, and I will bring that for you. Okay, so once you done the pain check, you can check the allergy check. Okay, Joe. Is that okay? Can you tell me, have you got allergic to any medicine, food, latex, or plaster? All right. You are allergic with one of the medication. Do you remember the name? Okay, the penicillin. All right. Okay. I can see that it is clearly mentioned on your document as well. Is that okay? Can I check your allergy band as well? All right. Yeah. It is clearly mentioned you are allergic to penicillin. Joe, do you know what happens when you take any medicine contains penicillin? Or you get short of breath. Okay, no worries. So I can assure that you won't get any medication that contain penicillin while you are admitted in hospital. Either myself or none of my colleague won't give any medication. Is that okay? So this is what you need to address when we are checking the allergy. So when you are checking the allergy, if you include medication, any medication, food, latex and plaster, then you covered everything. Yeah. So once you check that one, you need to check that the allergy band is there. So you need to check with the allergy band and with your document, and you need to clearly mention that it is verified. Yeah. Then you need to check with the patient. Do you know what can happen? If it is a medicine, accordingly you can ask. If it is a food, you can. Some patient can allergic with the peanuts or any kind of nuts. So you need to check that what happens when you eaten some food contains nuts. Then once you check that one, you need to assurance. So verify that. Then we need to reassure that. So what we need to reassure, either myself or none of the colleague won't give any medication or any food that contains whatever it will be according to allergy. That reassurance also need to give. Is that okay? So we done safety check, gel hands, introduce yourself, ID check, how to call, reason for admission, allergy check and pain check. Now the next one is the explain the procedure. So explain the procedure will be different based on what procedure you're going to do. So if it is an observation, an example, okay? Hi Joe, I'm here to do some set of observation so that I'm going to do blood pressure, pulse, temperature, respiration and saturation. Is that okay? If it is a medication, I'm here to do some of you giving you a 12 o'clock medication or 10 a.m. medication. So accordingly, what procedure you are going to do, accordingly you need to explain the procedure. So explain the procedure. When we are doing each procedure, we will explain accordingly. Is that right? So after the explaining the procedure, some of the procedure you need to assess the patient before you going to arrange the article. Some of the procedures you can straight away going for arranging the articles. So wherever we supposed to do the assess the patient area or whichever it will be, we will explain when we are doing that procedure. So otherwise, most of the procedure, as soon as you done the explaining the procedure, you can go and arrange the article. So before you going for arranging the articles, you need to make sure you giving the calling bell to the patient. Then you need to say that to the patient as well. Okay, Joe. So for that, for the procedure, I'm going to arrange the articles. So while I'm away, if you need anything, you can press this. Here is the bell. You can press the bell. Either myself or one of my colleagues will come and assist you. Is that okay? It will take 10 to 15 minutes for the procedure. If you need to go to loo or something, that's absolutely fine. If you need any assistance, please press the bell. Either myself or one of my colleagues will come and assist you. Is that okay? So once you given the calling bell, you're going to arranging the articles. Before arranging the articles, you need to wash your hands. If needed, as soon as done the wash hands, you need to wear the apron and then you need to arrange the articles. Arranging the articles according to each procedure. Wherever you're supposed to wear the apron, then only you need to wear the apron and glove. And the other thing is, there are 2 places you're supposed to do the wash hands in each of the stations. So one is, the first hand wash will be before arranging the articles, and the last hand wash will be once you completed all the procedure. After the dismantling the articles, you're supposed to wash hands. Again, some of the exam centers doesn't have sink, so you're supposed to do the hand gel instead of hand wash. So before you starting the procedures, or when the examiner show around that the room and everything, you can check that, you can observe where is the sink. If you are not able to see the sink, you can ask the examiner where is the sink for hand wash. Then the examiner will say that wherever you're supposed to do the hand wash, you can say that I'm supposed to do the hand wash, as there is no sink, I'm going to do the hand gel. Then you just do the hand gel procedure. Is that okay? Once you arrange the article, you will be coming to the patient with all those articles. So before arranging the articles, you need to check that if with the examiner, his equipments are calibrated and cleaned in over 24 hours. Yeah, so that need to be make sure as well. So once you brought all the equipments to the patient side, you need to say that yes, I'm back with all the equipments. Is that okay? Can I proceed? Okay, so then take that permission from the patient. Then you can start with the procedure. Each procedure will be different, so we will go through each procedure separately. Okay. So as we said, each procedure will be different, but the hand gel in between each of the procedure, that is more important. So which are the places you supposed to do the hand gel? So before beginning any procedure, you're supposed to do the hand gel, and after each procedure, you're supposed to do the hand gel. Again, in between the procedure, that is, whenever you feel that you touch the patient, you're supposed to do the hand wash. So before touching and after touching the patient, before documenting, after documenting, you're supposed to do the hand gel. And if you're wearing the glove, so before you wearing the glove, after removing the glove, you're supposed to do the hand gel. So you need to consider that which are the places you're supposed to hand gel in between your procedure. Is that okay? So once you've done all the any of the station, once you completed the procedure, the documentation is most important. Do not leave it for the last. Okay, so do the documentation then and there, then only going for the escalation. So complete the documentation before you do the escalation. In the documentation, if you miss out even in a date or time, even as tick, or if you are initial, anything in the documentation you missed out, it's an immediate fail. After the documentation, you're supposed to do the escalation. So escalation is based on what procedure you done. If it is an assessment station, so you need to do the escalate based on what your assessment score. If it is that we will be go through with the separate each procedure, accordingly we do the escalation as well. So after the documentation, you need to remember that you do the escalation to the patient. That is mainly based on what procedure you done, what is the outcome of that procedure, and what is your plan for that patient. And I will escalate to my team and my colleagues and my medical team. So that's what we need to do for the escalation. After the escalation, this is only for the assessment station. Okay, so after the escalation, if it is an assessment station, you're supposed to do the ADL discussion. As I said, ADL is activity daily living. So you need to say that I completed all your procedure, I done all your escalation. So is that okay? Can I chat with your activity daily living? Then we need to discuss with the patient what is their activity daily living. That including their physiological, psychological, sexual, and any bad habits like smoking and drinking. So we need to discuss each of the things Based on that, we need to give the health education to the patient, and also if needed any references, that also we need to explain to the patient. As I said, ADL discussion is only for the assessment station. So if it is not assessment station, you straight away going to the conclusion after the escalation. If it is an assessment station, after the ADL discussion, you go into the conclusion. So in the conclusion, I always say you need to leave 1 minute and 30 seconds, based on all the procedure. So each procedure having time limits are there. In assessment station 20 minutes, implementation station 15 minutes, and each skill stations are different times. Some are 12 minutes, some are 8 minutes. So accordingly, regardless of any stations, I always say that at least you should say 1 minute 30 seconds for the conclusion. It's only because in conclusion stage, we need to check with the patient, are they comfort? Do they need any position change? Do you have any concerns? So if you are asking these 3 questions, if the patient having any concern, or if the patient is asking some questions, we need to clear that as well with the patient. We cannot say that my time is running out, I am going away. So before that, so whatever the patient asking, we need to clarify with that patient. We need to make that patient comfortable as well. So do that. Then you need to give the call bell. Then you need to say that I'm going to dismantle the articles for the next person, and I'm going to wash my hands. So in that conclusion, clarify any concerns, comfort of the patient, providing the call bell, dismantling the articles, and hand wash. So that is the complete procedure. Thank you.